everybody, welcome to my new YouTube channel. I've recorded this video probably 10 times, so I don't have an external mic, I don't have fancy lighting, but you know what, we're gonna go with it. So, I don't know if you know who I am, but my name is Chelsea Roh. If you follow me on Instagram or Twitter or Facebook, you've probably seen all my blog posts and everything about our infertility journey. But if you are new, my husband and I have been on this journey for 2.5 years, and I thought since it's the last day of National Infertility Week, I would just jump on here and talk about our story. So we have been on this journey for 2.5 years, and it's been pretty traumatic so far. We got married 4 years ago, and I wanted to have babies right away, but Craig wasn't quite ready. So when you know, in the interim of him not being ready, I was kind of prepping my body for pregnancy, and I removed all the harsh chemicals from our house, like in our cleaning products and, you know, our laundry detergent. I removed all the toxic products that I was putting on my face and my body, and even Craig's. And, you know, I was just kind of doing good things, just waiting until he was ready. And so whenever he was ready, 1.5 years later, honestly, I thought it would happen immediately. Just given I have 28, 29-day cycles, I ovulate regularly. I could feel ovulation at the time. And so it happened on day 14, and, you know, it was switched, right, left, whatever. So in my head, I'm like, this should happen immediately. So 6 months goes by, and we are moving to Winnipeg, Manitoba here, where we're living now. And I was like, okay, I was a little discouraged, and I just happened to come across some forums, and it said that it takes couples typically 6 to 12 months to get pregnant. So that like eased my mind a little bit, but as like month 9 and 10 rolled by, I started to just get really discouraged. And so we used our connections here in Winnipeg, and we got in with the DC Obstetrics and Gynecology, and we got hooked up with Dr. Patterson. Love her. And so she did all kinds of tests on us, and just to see what was kind of going on. And honestly, nothing showed. Craig's morphology and his semen analysis was a little low, but other than that, my hormones were fine. We had an ultrasound, and it showed that I was ovulating regularly, which I already kind of knew, but you know, it was nice to kind of get it confirmed. So, but the ultrasound did show I had a polyp. So she told us that we weren't going to get pregnant until the polyp was removed. So I was drinking coffee, I was deadlifting, lifting all kinds of heavy weights, and we got pregnant in October of 2018. And, you know, it was my first positive pregnancy test. I was so excited. It was like, finally, this thing that I've just been praying for, like 13 months later, is here. And I got my first test 3 days after my missed period, my first positive test. And, you know, everything was going good. A week later, I started spotting, and then I started asking some questions. I called my doctor. She said, oh, spotting is normal. And then I went to a playoff game in the province next to us. It was -5 degrees. It was crazy. But I started spotting, and then I started having pain. And so I called my surgeon again. She called me back, and the following Tuesday, we had an ultrasound just to check for ectopic pregnancy, along with like some blood draws. So lo and behold, I was by myself. I go in for the ultrasound. I'm so excited just to take pictures and show them to Craig after he got off work. And, you know, one tech went in. She was in there for about 20 minutes or whatever, looking, couldn't find anything. Then she brought her manager in. The manager was looking, and I knew something was wrong then. And then after that, the radiologist came in. And so he brings me into the hallway, and yeah, with everybody around, it was just like, your baby's not in your uterus. You need to go to the emergency room right now. You could burst at any minute. And I'm like, okay. And obviously I lost it there, but I waited for Craig to get there, and we headed to the ER, and they ended up admitting me. And the surgeon that was on call at the time, she got pulled into a surgery, so we had to wait a couple hours, but I asked to see the films just to confirm where the baby was, and because there was questions. So We did in fact find out that the baby was in the tube, but it was closer to the ovary on the right tube. So we opted for the methotrexate route. You have two options when you have an ectopic pregnancy. You can have your tube removed, or you can get methotrexate. Methotrexate is the newer kind of treatment plan for ectopic pregnancies. It is basically the abortion drug. It stops fast cells from reproducing, and so basically it just depletes your body of just all the nutrients it needs to help things grow. So it was pretty traumatic to get this drug and having to make this choice. I was pretty irrational in the beginning, thinking like, I'm not going to do this, but it would have killed us both. So with ectopic pregnancies, you're not safe for your tube rupturing until your levels hit 0, your HCG levels. And mine ended up doubling within the first week of getting the injection, so I had to get more. And so it took 5 weeks for my ectopic pregnancy to just resolve itself. And it was pretty traumatic because you're not allowed to lift anything, you're not allowed to eat healthy. You basically just have to live a very sedentary lifestyle while you're depressed, thinking about this miscarriage and everything else. So yeah, that was November 2018. And then I started to have a lot of pain after that. And in April of the following year, my doctor decided to go in for a exploratory laparoscopic surgery just because I was having a lot of pain in that tube, and we just couldn't figure out why it happened. And sometimes it just happens to happen, but because I was in so much pain, she went in, and what she found it was supposed to be a 45-minute surgery, ended up being 2.5 hours. My whole entire abdomen was full of scar tissue. I mean, everything. My left tube and my left ovary were actually separated by scar tissue and like plugged to the back of my abdominal wall. So I never would have gotten pregnant with this side. And then the right, she cut into the tube to clear the blockage from the pregnancy, and she removed just a ton of scar tissue. And so we were pretty excited to hear about, this was our infertility. This is the reason why it was happening. And so I felt pretty calm about it, but I didn't, months went by and I just didn't know if this tube was open. So I flew down to Arizona. I paid for an HSG, which is an x-ray, and they shoot dye through your tubes to see if they're open. And lo and behold, they were. I was very relieved just to know, that it worked, and, all the trauma that we went through, there's some light at the end of the tunnel. And so we flew back, and typically they say that you have a higher chance of getting pregnant after those things, and I got pregnant within 2 weeks. And so I honestly was pretty shocked and really excited. We found out 3 days before my missed period, so the pregnancy was moving along quicker. My body was just getting used to being pregnant because it had been pregnant before. And so when you have an ectopic pregnancy, you have to get your labs drawn. You have to get your HCG checked every 48 hours to make sure it's doubling, to make sure it's a healthy pregnancy, because your chances of getting another ectopic pregnancy are a lot higher than everybody else's. So I was getting those labs done, and the baby was growing. Healthy, everything was doubling. My progesterone was a little bit low, but and I wasn't really having spotting. And then around 6 weeks, I started spotting again, and I was pretty freaked out. So called my surgeon, and she put me on bed rest, progesterone. My mother-in-law flew in from Arizona to take care of me because Craig was in his busiest time in football. It was the Labor Day Classic, and then the following week was the Banjo Bowl, which is the 2 rivalry games here in Winnipeg. And he wasn't able to stay with me here, so he flew out Saturday or Friday. He played his game on Saturday, and then came back, and we had an ultrasound scheduled on Tuesday. And so go in, at this point, I think, I don't know, I was numb, I was terrified, there were so many different things. And when you go into the hospital that my OBGYN works in, there is 2 rooms that are kind of like the emergency stat ultrasound rooms. And so the first time I was put in one bed, and I don't even believe in superstition, but the next time I asked her to be placed in the other bed because the trauma from the first one to the second one. So she starts everything, and she's pretty quiet, and then she brings somebody else in, and I knew. And so I asked if my husband could be in the room with me when they gave me the results. And then another radiologist comes in and just tells me by myself. Nobody communicated anything. But this time the baby was an inch from my uterus. It was right there. It was pretty sad. The baby was growing on par. It was like 6.5 weeks, just right on the money. We get rushed to the ER because I was internally bleeding already, because my tube was rupturing. It had a lot of trauma. First the ectopic pregnancy, then it was cut in two, and now a second one that the baby's growing rapidly. And so due to just the blood that was like in my abdominal cavity and the nature of my right tube, we decided to go with the emergency surgery. Now, the methotrexate likely wouldn't have worked because my tube would have burst anyway, but we had to make that decision. The doctors can't really, it was life-threatening, but I think just with probably miscarriage and everything, I think the patient has to make the decision. And I had other people there with me, so we were all able to be rational about it. And so I got rushed into emergency surgery. He removed my right tube and cleared up a bunch of scar tissue that he found again. And whether it was Dr. Patterson wasn't able to get it the first time, or it was newly developed after the laparoscopic surgery. So it's been 8 months since that happened, and I'm still recovering. My scar was supposed to be this big. It ended up being this big because he was trying to save my life. And so a lot of people are asking what we're doing now. We've always talked about adoption, we've always talked about fostering, but we are currently in a place in our life where they likely would not pick us. They wouldn't place us with the child because we have to do all the home assessment, and we don't really know where we're going to be in the US when we finally move back. And Craig has his tech job, but football isn't necessarily the most stable. So we were also going to start IVF later this year in Toronto, but with everything going on, we're just kind of waiting. So I decided in the interim of just waiting and everything, there's not much in modern medicine to help with scar tissue, but to go in and remove it surgically again, and I don't think my body can take another surgery. So we went to alternative medicine, and the Rohs have used this microcurrent, frequency specific microcurrent machine for many different ailments. And so I'm seeing a practitioner in Arizona that we bought the machine, and I'm trying to get rid of all the scar tissue. I'm trying to heal this tube. The tube, we had an MRI in January. It showed that it was calcified, hardened from all the trauma. And so the percentage chances of us having another ectopic pregnancy, if we get pregnant, is high because of this tube. It's damaged. So trying to heal that while we just wait for whatever's going to happen with this whole COVID situation. And I know a lot of people on this journey, they've had their cycles canceled. Just there's so many things. So I'm just fortunate that we didn't start the process and start the egg retrieval and then get to the point where we couldn't, do anything. So yeah, I'm just kind of praying on what God wants us to do. We're going to start with the adoption process in the US and kind of just, do the most that we can there until we get to the United States. And yeah, we're just kind of waiting it out. So thanks for listening to my journey. On my blog, I put a ton of stuff that I tried before, because I don't have a hormone imbalance. I don't have a lot of that stuff now. We know I just have a propensity to build scar tissue. But I tried acupuncture, I tried fertility massage, I tried a ton of different things. So it's all on my blog, but I'm just going to talk about it here on the YouTube channel as well. So if you want to know anything, just drop it in the comments and I can put it in my next video, or I can make a whole other video about it. I did want to talk about football. I never really got around to it during season, and which was kind of unfortunate because we won the Grey Cup this year. But yeah, I'm just gonna, if we do adoption, if we foster, if we do IVF, I'm just gonna document it on this channel. So it'll make it a lot easier, and we can just inform everybody. So, all right, thanks, guys.